Good afternoon, everyone. My name is Nicholas Chartres, and I'm a research scientist at the Program on Reproductive Health and the Environment here at UCSF. And I greatly appreciate the opportunity to present today on a large part of the work we've been doing here at UCSF over the last 18 months to 2 years, and that is defending the science and highlighting the flaws in the Toxic Substances Control Act systematic review method that is currently being used in the first 10 draft risk evaluations EPA is reviewing under the new TSCA legislation. Before I begin, I have no conflicts to disclose. I think it's always important to start with the definition of a systematic review, and that is to identify, appraise, synthesize all the empirical evidence that meets pre-specified eligibility criteria to answer a specific research question using explicit systematic methods that are selected with a view aimed at minimising bias, and I'm going to come back to that a number of times throughout today's presentation, to produce more reliable findings to inform decision making. And systematic review originated more than 40 years ago in psychology, and the methodology was soon adapted to evaluating the effectiveness of clinical interventions in medicine and related disciplines in response to empirical evidence demonstrating the need to apply scientific principles not only to the primary research that was being conducted, but also to research synthesis methods that inform decision-making in healthcare. And today, very much so in the clinical arenas, decision-making in these areas relies on systematic review methods that establish the rules for developing trusted evidence-based advice, and they inform billions of dollars in healthcare spending every year. And these rigorous, transparent, empirically based methods are now embodied in groups such as the Cochrane collaboration, also GRADE, which you can see at the bottom of the slide there. GRADE is the grading of recommendation, assessment, development and evaluation. And there are also standards that are widely agreed upon for developing high quality systematic reviews of comparative effectiveness research, such as those at the Institute of Medicine for finding what works in healthcare, standards for systematic review methods. And the IOM, or the Institute of Medicine, recommends 21 standards that address the entire systematic review process, from the initial steps of formulating the topic to the publishing of the final report that synthesises what the evidence shows around a particular question. And it's important to note that while standards are voluntary, they allow us to set a benchmark against what the quality of a systematic review being evaluated should meet. However, in contrast to the clinical sciences, environmental health has historically relied on expert-based narrative review methods. And while the universal nature of the fundamentals of systematic review methods from the clinical sciences results in a broad overlap in what constitutes sound practices in systematic review in environmental health, there are some important differences that mean that the systematic review methods used in environmental health have needed to be adapted to be used since they've been taken from the clinical sciences. And as you can see on the slide, these differences include, firstly, the type of evidence being summarised. You can see in the top right-hand corner there, with a focus in environmental health on observational human, experimental animal, and also in vitro study designs intended to elucidate disease etiology and identify health risks, as opposed to methods for identifying effective treatments for disease using a body of evidence which usually contains randomised controlled trials in humans in clinical systematic reviews or clinical science systematic reviews. Secondly, the types of decisions potentially being supported by systematic reviews, for example, defining the conditions for acceptable use of chemical substances rather than informing healthcare intervention decisions, are obviously different. And then finally, the specific methodological challenges associated with environmental health systematic reviews include how to integrate evidence from human, animal, in vitro and in silico studies, as opposed to using only human data in clinical systematic reviews. However, a group of colleagues here at the Program of Reproductive Health and the Environment, led by Tracy Woodruff and Patrice Sutton, initiated the field of systematic reviews in environmental health way back in 2009, and they established an interdisciplinary collaboration that ultimately developed the navigation guide, rulebook or methodology that you can see on the left-hand side there, It's a groundbreaking novel method published back in 2011. And our navigation guide method, along with the National Toxicology Program's Office of Health Assessment and Translation, which you can also see on the slide there on the right, have had revolutionary impacts, transforming methods to favour systematic and transparent reviews with greater emphasis on consistent approaches to evaluating evidence, all of which supports more equitable decisions that will prevent harmful toxic chemical exposures in human populations. And as this timeline shows, for over a decade, these empirically proven methods for research, synthesis, and environmental health have been implemented, and significant developments and advances have been made throughout that time. So just a couple of dates that I'll highlight. Firstly, in 2011, the navigation guide, as I mentioned, was published. Moving on to 2015, the OHAT handbook was published. And then not until 2018, May of 2018, was the draft TSCA systematic review method made publicly available. And to date, the science-based methods for systematic review and environmental health outlined in the navigation guide have been demonstrated in 6 case studies in the peer-reviewed literature, adopted by the National Toxicology Program, as a basis for their handbook. And it's also currently being used by the World Health Organization and International Labour Organization to assess the global burden of work-related injury and disease. And I believe they're up to the 15th systematic review in this project. So I suppose the takeaway is that environmental health systematic review methods have been extensively used and validated over the last decade through the use of the navigation guide and also the National Toxicology Program's Office of Health Assessment and Translations handbook. Another important thing to note is that the National Academies of Science have been involved in reviewing and recommending best approaches to systematic review use, and in their 2014 review of the EPA IRIS program, which are the preferred source of toxicity information used within the organisation, the NAS recommended the use of systematic review for assessing chemicals in the IRIS assessment. Then in 2017, the NAS used the OHAT method and the navigation guide method to evaluate low-dose toxicity from endocrine active chemicals. And to assess the harms in human studies, instead of conducting an entirely new review, the NAS used the navigation guide's published systematic review on PBDE, flame retardant exposure, and IQ, and they concluded that it was a high-quality review free of bias. And finally, and very recently in 2019, the NAS provided critical recommendations needed to improve the US Department of Defense systematic review method used to derive an occupational exposure level for trichloroethylene, and recommended to the DOD, and I quote, as you can see on the screen here, if DOD's intent is to perform a credible systematic review, the committee suggests following one of the established methods, and you can see there they cite Woodruff and Sutton, which are the authors of the original navigation guide method, and they also cite the NTP's OHAT method. So, EPA is required. I'll take a step back. So now that we've talked a little bit about the evolution of systematic reviews in environmental health, we arrive to May 2018 when the draft application of systematic review and TSCA risk evaluations was released, which you can see on the screen to the left-hand side there. And EPA is required by TSCA statute to use the best available science and the weight of the scientific evidence to make decisions about chemical risks. And EPA defined the weight of the scientific evidence in its 2017 risk evaluation rule. You can see on the screen here a quote, which is how it's described, or how the rule is codified, which is a systematic review method that uses a pre-established protocol to comprehensively, objectively, transparently, and consistently identify and evaluate each stream of evidence, including strengths and limitations, and relevance of each study, and to integrate evidence as necessary and appropriate. There are several important parts of this definition that ensure EPA has the best evidentiary basis for its decisions. Firstly, that it has to use a systematic review method. Second is the need for a pre-established protocol, and this is to avoid bias within the evaluation. And third is the need for the review to be comprehensive. And the fundamental purpose of a systematic review, as I've already highlighted, is to evaluate the evidence base of all the science relevant to the review question and determine a conclusion from a body of evidence as a whole. However, EPA's TSCA systematic review framework is ad hoc, incomplete, and does not follow established methods for systematic review that are based on the best available science. A fatal flaw in EPA's systematic review framework is that it lacks essential systematic review elements, including but not limited to, as you can see on the slide here, firstly, a protocol for executing the systematic review developed prior. That's a very important component of it, prior to conducting the systematic review. The use of explicit predefined inclusion and exclusion criteria that are meticulously applied to a body of evidence. Third, a validated method for evaluating the quality of the individual studies included within the review. And four, an explicit method for integrating two or more streams of evidence that is predefined within a protocol. And as I'm going to show you, EPA's piecemeal approach is not only in direct contradiction with the best available scientific methods for systematic review, but it's also incompatible with the regulatory definition of a weight of evidence in the risk evaluation rule, which specifies a complete method spelled out in a protocol and developed before conducting the review. So therefore, TSCA's systematic review method violates both TSCA statute and regulation. And we're now going to take a look at these four critical issues that I've just raised with the TSCA systematic review method. So the first critical issue is that EPA explicitly states that it's proceeding with its first 10 risk assessments, or risk evaluations rather, in the absence of a predefined protocol and a complete method for systematic review. And specifically, EPA's systematic review framework states, and I'm going to quote from the slide here, EPA had limited ability to develop a protocol document detailing the systematic review approaches and/or methods prior to the initiation of the risk evaluation process for the first 10 chemical substances. For these reasons, the protocol development is staged in phases while conducting the assessment work. So in effect, EPA is saying it does not have time to comply with its regulatory requirement to conduct a science-based systematic review and will not actually develop its protocol until it completes the first 10 systematic reviews. And this is a critical piece because creating protocols for a review prior to conducting the review minimises bias and it ensures transparency in the decision-making process, and thus is specified as best practice by all established systematic review methods, and as you're about to see, by the Institute of Medicine in its standards. So the IOM, who I mentioned or I introduced in my earlier slides, has several standards for protocol development as shown here. And these standards are critical because preparing and publishing a clearly conceived and well-written protocol reduces the reliance on post hoc decisions. And also publishing the protocol in advance gives readers access to the plan from which the review will be developed. And then it also helps them to judge how the eligibility criteria of the review, stated outcomes and plan methods will address the intended questions of interest. What you can see here is the development of the draft risk evaluation for carbon tetrachloride, and I want to take you through the timeline which certain documents were published. So starting at the top, you can see the literature and screening strategy as specifically applied to carbon tetrachloride is described in Strategy for Conducting Literature Searches for Carbon Tetrachloride, and this was published in June 2017. The results of screening were published in Carbon Tetrachloride Bibliography Supplemental File, the TSCA document, in June 2017. However, the studies determined to be on topic or relevant after title and abstract screening, EPA conducted a full text screening to further exclude references that were not relevant to the risk evaluation. Screening decisions were based on eligibility criteria documented in the form of the population, exposures, comparators, and outcome framework, also known as a PICO framework. The inclusion and exclusion criteria for this full text screening for carbon tetrachloride are made available, as you can see in the bottom here, in the problem formulation of the risk evaluation for carbon tetrachloride, which was published in May of 2018. And this was published after the searches and the initial screening of title and abstract had already been completed. However, it is critical that the PICO statement should shape the entire review process, including the search strategy to be used, the study eligibility criteria to be applied, how the data will be extracted from the included studies, the strategy for synthesizing the evidence, and how the results will be reported. And therefore, it must be published in the protocol prior to any steps of the systematic review process has been commenced. Therefore, this approach that EPA has taken under the TSCA method is in clear violation with scientifically validated approaches to conducting systematic reviews. And this slide here, which I'm going to use to summarise each flaw in the systematic review process, shows the NAS recommendation for how this step should be conducted at the top, the number of times EPA has failed to adequately address this step in the draft risk evaluations to date in the middle, and then finally, at the bottom, the comments that the Science Advisory Committee on Chemicals have made in their peer reviews of the draft risk evaluations EPA have released to date on how EPA are currently conducting this step. And as you can see at the top there, in its review of the EPA's IRIS program, the NAS proposed that completing or stated that completing the literature search as part of the protocol development is inconsistent with best practices for systematic review. And the IRIS program is encouraged or was encouraged to finalise the protocol before initiating the systematic review. One other point I would like to make is that the lack of time that EPA cites is not a credible rationale for failing to conduct a science-based systematic review, including the use of pre-established protocols for the first 10 TSCA chemicals. There are multiple well-developed science-based, peer-reviewed and validated methods for conducting systematic reviews in environmental health that I've already highlighted, including how to develop protocols that EPA could readily apply, including the methods of OHAD and the Navigation Guide systematic review methods. So the second critical issue is that the literature review step of EPA's TSCA systematic review method incorporates select best practices, but it also falls short or is unclear about many other of the best practices for conducting a systematic and transparent literature review. So we compared EPA's framework for systematic review to the IOM's best practices for the literature review step of a systematic review, which you can see here on the slide. And this step was also applied by the NAS in its review of EPA's IRIS program method for systematic review. And as you can see here on the slide, we found that EPA's framework to be consistent with only 12 of the IOM's 27 best practices for conducting a literature search. One key feature of EPA's process for how they identify and account for the evidence used in the draft risk evaluations that is clearly inconsistent with IOM's best practices is that EPA fails to include or exclude studies based on the protocol's pre-specified criteria, a practice that is critical to avoiding results-based decision-making. Predefined, unambiguous eligibility criteria are a fundamental prerequisite for a systematic review. In particular, post hoc decisions about inclusion or exclusion of studies should keep pace with the objectives of the review rather than with arbitrary rules that are made as the review is conducted. And also, very importantly, decisions should therefore be documented for all records identified by the search. Number of records are sufficient for exclusions based on initial screening of title and abstracts. However, it is critical that studies excluded at the full text stage, which are those that a user might reasonably expect to find in a review, should have at least one explicit reason for their exclusion documented. So, this is an example of how and why studies were excluded from one of the Navigation Guide systematic review case studies, looking at developmental PBDE exposure and IQ and ADHD. And as you can see, there is clear documentation to account for each reference as it moves through the review process based on predefined eligibility criteria being applied to it. Importantly, as you can see on the right-hand side there, there is an explicit reason given for the exclusion of studies at the full text screening step. Now, this is an example of the carbon tetrachloride literature flow diagram for human health hazards, which is the same draft risk evaluation that I showed highlighting the post-hoc development of the PICO questions, inclusion criteria, and the absence of protocols in the previous slides. In the draft risk evaluation for carbon tetrachloride, it states that EPA developed and applied inclusion and exclusion criteria during the title and abstract screening to identify information potentially relevant for the risk evaluation process. The results of screening were published in carbon tetrachloride bibliography supplemental file for the TSCA document. Now, when you go to the carbon tetrachloride bibliography supplemental file for the TSCA document, there are 107 pages of on-topic references, which equates to approximately 2,500 to 3,000 references. However, below this figure I'm showing you here in the draft risk evaluation for carbon tetrachloride, EPA states, and I quote, "The literature search strategy used to gather human health hazard information for carbon tetrachloride yielded 6,489 studies. Of the 6,489 studies identified for carbon tetrachloride, 6,454 were excluded as off-topic during the title and abstract screening phase." So therefore, according to the results of the screening published in the carbon tetrachloride bibliography supplemental file, there are around 2,500 to 3,000 on-topic references that EPA have not accounted for or screened at the full text stage with any reason given for their exclusion in this flow diagram shown here in the draft risk evaluation. This lack of transparency in the decision-making process on how and why studies have been excluded in the carbon tetrachloride draft risk evaluation is deeply concerning and is reflected in every one of EPA's draft risk evaluations to date. And as the NAS noted, it is crucial that the selection of eligible studies is based on pre-specified criteria in a manner that limits potential for bias, and they even cite the IOM standard 3.3. Screening studies requires careful judgment and meticulous documentation about eligibility, which was not done, as you can see in the study flow diagram. The third critical issue in the TSCA systematic review method is how EPA evaluates the quality of evidence, which is analogous to risk of bias. When evaluating the quality of individual epidemiological studies, we've identified three key issues with how EPA implements this process. Firstly, as shown here, EPA's scoring method wrongly conflates how well a study is reported with how well the underlying research was conducted. Study reporting addresses how well research findings are written up. That is, whether there is complete and transparent descriptions of what was planned, what was done, what was found, and what the results mean. The strengthening of reporting of observational studies in epidemiology, or Strobe, or the Strobe Statement, which you can see here, is an example of a checklist of items that should be included in articles reporting on research. An EPA systematic review framework uses reporting measures such as these in its scoring of the quality of human studies, including incorporating reporting guidelines into the reasons for scoring studies low quality and even unacceptable for use, which I'm going to explore a little bit more. EPA's systematic review framework even acknowledges that reporting is not the same as an underlying flaw in the study methodology, but it then proceeds to ignore this distinction by using reporting as a measure of the quality of the underlying research. What's also important to note is that the authors of the Strobe guidelines specifically state that guidelines are not a measure of the quality of the underlying research, stating, and I quote, "The Strobe Statement is a checklist of items that should be addressed in articles. The intention is solely to provide guidance on how to report observational research well. Also, while clarity of reporting is a prerequisite to evaluation, the checklist is not an instrument to evaluate the quality of observational research." So for those of you who are unfamiliar with what risk of bias is, here's a definition. It's the systematic error or deviation from the true results or inferences of a study. And it's a feature of the study's design, conduct, or reporting that leads to an under or overestimation of the true results of the study. And these are the domains in a randomised controlled trial in which we assess the risk of bias of a study. And we know from empirical studies that a lack of randomisation and blinding of outcome assessment in drug studies leads to an overestimation of the efficacy of the drug and an underestimation of the harms of a drug. And while there is no empirical evidence to show such associations between certain domains used in observational research and the magnitude or direction of study results, the navigation guide and the National Toxicology Program's OHAP method have developed tools that are derived from the tools used in the clinical sciences, such as the Cochrane tool I just showed you before, that focus on constructs of bias, and importantly, not on how well a study is reported. So the second main issue with how the TSCA systematic review method evaluates the quality of the epidemiological evidence is the use of quantitative scores for assessing the quality of an individual study that are both arbitrary and not science-based. And the implicit assumption in such quantitative scoring methods is that we understand how much each factor used to evaluate study quality contributes to the overall quality, which you can see in the bottom right-hand side of the slide here, that is using the TSCA scoring system, and that these factors are independent of each other. This is not scientifically supported as an assumption, and researchers have documented that such scoring methods have unknown validity, may contain invalid items, and that the results of a quality score are not predictive of the quality or risk of bias of studies. And the NAS has recommended strongly against the use of such scoring systems. The third main issue with how the TSCA systematic review method evaluates the quality of epidemiological evidence is the EPA's scoring method excludes research based on one single reporting or methodological limitation. EPA has created an arbitrary list of metrics that make studies unacceptable for use in hazard assessment, stating EPA plans to use data with an overall quality of high, medium, or low confidence to quantitatively or qualitatively support the risk evaluations, but does not plan to use data rated as unacceptable. Studies with any single metric as 4 will be automatically assigned an overall quality score of unacceptable, and further evaluation of the remaining metrics is not necessary. But once again, there is no empirical basis for EPA's selected list of fatal flaws. Now I'm going to show you an example here. This is one of the 22 metrics that EPA uses to assess study quality. Yes, that's right, 22. The tools that I showed you before, such as the Cochrane tool for randomised controlled trials and the navigation guide tool, use between 7 to 9 domains. This uses 22 different metrics where a study can be excluded if it is rated unacceptable across one of them. So this is metric 13, which is statistical power. First and foremost, with this metric, EPA provides no method for how it will determine the adequacy of the statistical power of a study on which it's going to base its score, or which a reviewer can base its score, and provides no rationale for excluding studies with less than 80% statistical power. Further, EPA's metric for statistical power is confusing bias with imprecision. For example, a small study may be imprecise, but that should not be confused with whether it is biased or not. A small study can be imprecise, but at the same time be far less biased than a larger study. And small, underpowered studies can be combined in meta-analysis that increase the statistical power of the body of evidence to reflect the relationship between an exposure and a health outcome. Therefore, individual studies that are underpowered, for example, because in the real world, the exposed population may not be large enough for statistical purposes, even if they are health impacted, can still be potentially valuable to science-based decision-making. Now, I'm going to show you an example of how damaging this metric and the use of this unacceptable rating can be to a body of evidence. In 2017, a systematic review we conducted on developmental PBDE exposure and the outcome of IQ and ADHD in childhood. We conducted a meta-analysis in which none of the 4 high-quality studies included in the meta-analysis used a power calculation. And yet together, these studies found a 10-fold increase in PBDE exposure associated with a decrement of 3.7 IQ points. However, we've recently applied the TSCA tool to this very same sample of studies to see what it would do to the entire body of evidence. And this is what we found. And as you can see on the far right-hand side, for statistical power, every study would have been excluded from the body of evidence due to an unacceptable rating in metric 13. And therefore, the finding that we identified rather, with the association of increased PBDE exposure and the decrement of IQ points would not have been established. Further, the exclusion of studies based on one acceptable criterion is not consistent with EPA's 2017 framework rules, which requires EPA to consider all relevant science while accounting for strengths and limitations. And the NAS has recommended for this step in the systematic review process not to include quantitative scores, as they are contrary to standard systematic review practices, as numerical scores falsely imply a relationship between scores and effector association, along with several other critical limitations. So finally, the fourth and final critical issue that I'll discuss with the TSCA systematic review method is how EPA have failed to thoroughly describe how the evidence streams, so the human, animal and mechanistic data that have been identified, evaluated and synthesized, are then integrated in the draft risk evaluations. EPA states in the TSCA systematic review method that, and I quote, during data integration and analysis, EPA considers quality, consistency, relevancy, coherence and biological plausibility to make final conclusions regarding the weight of the scientific evidence. Data integration involves transparently discussing the significant issues, strengths and limitations, as well as the uncertainties of the reasonably available information and the major points of interpretation. However, EPA does not rate the confidence in the body of evidence in the draft risk evaluations, and nor does it follow a predefined evidence integration protocol to come to its final conclusion that a chemical does or does not pose an unreasonable risk. Therefore, it is unclear how EPA translates the available evidence into its final hazard conclusions or its final conclusions. There are several very well-established methods for how this process should occur using explicit, predefined and reproducible methods. Evidence integration consists of, at a minimum, as you can see here on the screen, qualitatively rating the confidence in the overall body of evidence for a specific outcome. And this is the OHAP method, which is adapted from the grade approach, which I referenced at the start of the presentation. And as you can see, there are 5 criteria for rating the evidence down: risk of bias, indirectness, inconsistency, imprecision, and publication bias. And then there are 3 that increase it: large magnitude of effect, dose response, confounding minimizes effect. The next step of the process then involves translating that confidence rating into a conclusion on the level of evidence for health effects, and then developing hazard identification conclusion as shown here. And when there is available animal and human evidence, it should be integrated together with mechanistic data to also inform the final conclusion. So as you can see here on the y-axis on the left-hand side, the level of evidence needed to determine the health effects for human studies is shown, and along the x-axis and along the bottom there, the level of evidence needed to determine the health effects from animal studies is shown. Therefore, the ad hoc nature of the process outlined in the draft risk evaluations is not transparent or reproducible like these best practices, and threatens the validity of any conclusions that are made within the draft risk evaluations. And again, as the NAS recommends for this step, EPA should continue to improve its evidence integration process incrementally and enhance the transparency of its process. If EPA does move to a structured evidence integration process, it should combine resources with NCP to leverage the intellectual resources and scientific experience in both organisations. So in sum, there are well-established, validated systematic review methods in environmental health that have been developed to ensure transparency, reproducibility, and again, coming back to this idea of minimising bias in the decision-making process that the US EPA could use to improve the TSCA systematic review method. Further, the NAS has made multiple recommendations over the last decade for how a systematic review should be conducted, and US EPA TSCA systematic review method does not include a majority of these steps. Thank you very much, and I look forward to answering your questions.